Our last panelist, but definitely not the least, is a harm reduction advocate. He is the founder and executive director of IDUCARE, a peer-based community for people affected by drugs. IDUCARE provides access to HIV, hepatitis C counseling, screening, and treatment. Let us welcome Johann Panki Nadela.
Hi. So yeah,
Let me
can
set up my
you
slides.
have my slide?
So we are I Do Care. I Do Care is based here in the Cebu City in the Philippines. So we started 2015. So we are a community-based organization for drug users. So what I represent in the slide is just our services and just more on pictures of what we are doing. So we are not we don't do research on drugs. We are just health service providers for drug users. So yeah, so let me start with this quote: "What possible when people are able to organize and volunteer their own communities." So before we started with 2015, we gathered community, drug user community, and we have a 3 day consultation with them, and we came up with IDUCARE model within that consultation, and we laid out the objectives and components of the organization and detailed activities we set out to conduct. So this is the picture of the activity of the consultation, and most common of that is just to have a community center. They have a they group they I we group them, and they draw and they explain, and this is the pictures, and most common is that they really want to have a community center in the. So yeah, the next slide is maybe as far as I can remember, those are the services they wanted in the drop-in centers, or we call it community centers or drop-in centers. So let me just say our service are first medical services. So we have a free medical services there, which is the HIV screening and testing, and we also do treatment in HIV. We also have hepatitis C testing and hepatitis B testing, and we also have a hepatitis C treatment free. And we also do have a viral load there in the drop-in centers, hepatitis viral load and HIV viral load. And aside from that, we also have mother to STI, sexually transmitted infections treatment there. And we also have a free doctor consultations in the drop-in centers. And aside from the medical services, let me just mention also we also have a free medicines there in the common medicines, like like paracetamols and anything for flu, for cough, if you just go to the drop-in centers. And we do also have health promotions. We do outreach works, or aside from outreach works, in the drop-in centers, we also have HIV awareness, hepatitis awareness, VMTC PAP, mother to trans transmission awareness, STIs, and we do also have motivational interviewing. So the community, or the drug users community, the I Do Care community is also trained motivational interviewers, and they also are trained paralegal aid. They also do paralegal literacy and paralegal services in the drop-in centers. We do also have individual crisis assistance, means we do also give care package, food box in our outreach works or in the drop-in centers. The care package are like now is the pandemic, so we give masks, we give hand sanitizers, alcohol, soap, And for the female drug users, we also give them sanitary napkins and food packs. And under the food packs, we give them rice, canned goods, or the usual food packs. And we do also have a burial services. So yeah, so because our drop-in centers are our community centers were run by the community, but were given we don't have a rent from the religious sect. So we also have learning group sessions, psychosocial services. We call it psychosocial. So in the psychosocial services, we have a spiritual attainment. We have a learning group sessions activities. We have a focal group discussions. What are the what are what are the topics of the learning group sessions? Are the family counseling, adherence treatment, or disclosure counseling, and others. Aside from that, aside from our this is supposed to be our pictures. This is our drop-in centers with a doctor doing a learning groups about HIV and hepatitis C. So yeah, aside from that, we also do outreach like community service. Like we do also do cleaning service in the drop-in in the streets. Like we also do volunteers like painting in the walls, clean services, or proper disposal of syringes. We pick up syringes safely in the streets, in the how do you call it, target barangays where where are lots of drug users there. So we go and we clean it for proper disposal, and we teach them also how to properly dispose their any biohazard. Yeah. So and we are also doing referrals and networks. So yeah, we also have community events. This picture represent that we also do, like we are also invited for a gig, like a gig event. So we do counseling there. We do HIV awareness before the gig or outside the gig, where we have a booth and we can have a community-based screening, HIV 101 and others. Not just a gig, we also invited for a tattoo competitions and other big events. So now, I think we're doing right, because the indicator there is that we're already invited from other stakeholders or other advocacy partners doing we present our what are we doing in the even internationally. We're invited in other conference or other to represent. So that's the indicator that the drug users are doing right in helping others. That shows that drug users can be productive in the society. Okay, we have this picture again. So this is we also develop a paralegal training module. Means the module we develop is really consulted by the community. So we're training them using our paralegal training module. So yeah, we hope so that they can be, hopefully they can also, some old drug users can help them to each others using our trained modules. So yeah, that's indicator that doing right. So because of that, we have invited from others advocacy partners. We are also we are invited for consultation like drug policy, like HIV, new HIV law. We also do new. We've been consulted. Even the community-based drug rehab, we are invited for that to to take on the module. So yeah, that's the indicator that we are doing great. Yeah, I'll just stop here. I just want to end my last, because the drug users are also people, are also human. They have heart. They want to live in a normal life. They want to live in dignity, and they can be also productive. I think I'll just end here because I don't know. My slides is didn't work. I didn't see anything here in my screen. So yeah, I'll just stop here. And thank you very much for listening.
Thank you very much, Panki, for sharing the model and experiences of IDUCARE. So we appreciate that these services are not apart but are actually essential towards recovery.